In February 2020, the CDC confirmed a COVID-19 infection in California in a person who had not traveled to an affected area or been exposed to someone with the disease. This marked the first instance of community spread in the U.S. It's likely that person was exposed to someone who was infected but didn't know it. How fast is it spreading? The number of people infected by SARS-CoV-2 changes every day. See our news story for the latest updates on this developing story. How contagious is the coronavirus? The transmission rate is relatively high. Early research has estimated that one person who has it can spread it to between 2 and 2.5 others. One study found that the rate was higher, with one case spreading to between 4.7 and 6.6 other people. By comparison, one person who has the seasonal flu will pass it to between 1.1 and 2.3 others. We can work to lower the transmission rate by washing hands often, keeping common surfaces clean, limiting contact with other people, and wearing cloth face masks when we can't stay 6 feet away from others. Can coronavirus be transmitted through groceries, packages, or food? You're much more likely to get COVID-19 from another person than from packages, groceries, or food. If you're in a high-risk group, stay home and use a delivery service or have a friend shop for you. Have them leave the items outside your front door, if you can. If you do your own shopping, try to stay at least 6 feet away from other shoppers. That isn't always possible, so wear a cloth face mask, too. Wash your hands for at least 20 seconds before and after bringing things into your home. The coronavirus can linger on hard surfaces, so clean and disinfect countertops and anything else your bags have touched. You can wipe down plastic, metal, or glass packaging with soap and water if you want. There's no evidence that anyone has gotten COVID-19 from food or food containers. Coronavirus diagnosis: call your doctor or local health department if you think you've been exposed and have symptoms like fever of 100 or higher, cough, trouble breathing. In most states, decisions about who gets tested for COVID-19 are made at the state or local level. A swab test is the most common method. It looks for signs of the virus in your upper respiratory tract. The person giving the test puts a swab up your nose to get a sample from the back of your nose and throat. That sample usually goes to a lab that looks for viral material, but some areas may have rapid tests that give results in as little as 15 minutes. If there are signs of the virus, the test is positive. A negative test could mean there is no virus or there wasn't enough to measure. That can happen early in an infection. It usually takes 24 hours to get results, but the tests must be collected, stored, shipped to a lab, and processed. The FDA is granting emergency use authorizations for tests that don't have full approval yet. These include a home nasal swab test, a home saliva test, and tests that check your blood for things called antibodies. Your immune system makes antibodies in response to an infection. A swab test can only tell whether you have the virus in your body at that moment. But an antibody test can show whether you've ever been exposed to the virus, even if you didn't have symptoms. This is important in officials' efforts to learn how widespread COVID-19 is. In time, it might also help them figure out who's immune to the virus. The FDA is working with laboratories across the country to develop more tests. Coronavirus prevention: take these steps. Wash your hands often with soap and water or clean them with an alcohol-based sanitizer. This kills viruses on your hands. Practice social distancing. Because you can have and spread the virus without knowing it, you should stay home as much as possible. If you do have to go out, stay at least 6 feet away from others. Cover your nose and mouth in public. If you have COVID-19, you can spread it even if you don't feel sick. Wear a cloth face covering to protect others. This isn't a replacement for social distancing. You still need to keep a 6-foot distance between yourself and those around you. Don't use a face mask meant for healthcare workers. And don't put a face covering on anyone who is under 2 years old having trouble breathing, unconscious, or can't remove the mask on their own for other reasons. Don't touch your face. Coronaviruses can live on surfaces you touch for several hours. If they get on your hands and you touch your eyes, nose, or mouth, they can get into your body. Clean and disinfect. You can clean first with soap and water, but disinfect surfaces you touch often, like tables, doorknobs, light switches, toilets, faucets, and sinks. Use a mix of household bleach and water, 1/3 cup bleach per gallon of water, or 4 teaspoons bleach per quart of water, or a household cleaner that's approved to treat SARS-CoV-2. You can check the Environmental Protection Agency (EPA) website to see if yours made the list. Wear gloves when you clean and throw them away when you're done. There's no proof that herbal therapies and teas can prevent infection. COVID-19 preparation tips. In addition to practicing the prevention tips listed above, you can meet as a household or larger family to talk about who needs what. If you have people at a higher risk, ask their doctor what to do. Talk to your neighbors about emergency planning. Join your neighborhood chat group or website to stay in touch. Find community aid organizations that can help with health care, food delivery, and other supplies. Make an emergency contact list. Include family, friends, neighbors, carpool drivers, doctors, teachers, employers, and the local health department. Choose a room or rooms where you can keep someone who's sick or who's been exposed separate from the rest of you. Talk to your child's school about keeping up with assignments. Set yourself up to work from home if your office is closed. Reach out friends or family if you live alone. Make plans for them to check on you by phone, email, or video chat. Can a face mask protect you from infection? The CDC recommends that you wear a cloth face mask if you go out in public. This is an added layer of protection for everyone, on top of social distancing efforts. You can spread the virus when you talk or cough, even if you don't know that you have it or if you aren't showing signs of infection. Surgical masks and N95 masks should be reserved for healthcare workers and first responders, the CDC says. Is it safe to travel during a pandemic? Crowded places can raise your chances of getting COVID-19.